Shanghai, China is set to continue its strict zero-COVID strategies and lockdowns despite the recent decrease in its COVID-19 infections. Iya De Vera would tell us why live. Good evening, Iya.
Good evening, Elsie. Shanghai's ongoing strict lockdown recently showed a hopeful decline with its COVID cases, but are quickly disappointed on Monday as 58 new cases were identified in regions outside of its quarantine areas. Shanghai saw a significant drop in new cases with over 27,000 per day 3 weeks ago, down to just around 7,000 each day over the weekend. Chinese authorities, however, are determined to keep its zero-COVID strategies of quarantine and lockdowns, much to the public's dismay. Ongoing fear remains over outbreaks continuing to overwhelm the healthcare system and lead to more deaths, especially within the unvaccinated elderly. Experts outside China say that it is time for the country to start living with COVID, as most of the countries around the world have done. Vice President Richard Reitinger of Global Health at RTI International recognized the current effective treatments, such as vaccines, that can aid China in easing up on its restrictions. Reitinger added that instead of lockdowns, social distancing plus double the vaccination efforts, along with other effective preventative protocols, should be the focus of the system. Millions of residents have been locked in their homes for more than 3 weeks with minimal to no access to food and services, and many continue to suffer from being locked down. Meanwhile, in Beijing, cases continue to rise and authorities ramp up mass testing for more than 20 million people to avoid reaching Shanghai's proportions and ending up in another citywide quarantine and lockdown. Elsie?
Iya, what are the latest COVID statistics for China?
Yes, Elsie, 7,822 new cases were reported Sunday, bringing the total cases to 217,452. 32 new deaths were reported from Shanghai, bringing the death toll to 5,092 since the pandemic started. 192,182 cases were reported to have recovered from the virus. Back to you, Elsie.
Thank you, Iya De Vera, for that live report.